Hi, this is Dr. Lara. Today we're going to talk about the TMJ. Many people have heard the term TMJ but are not exactly sure what it means. TMJ is an acronym for the temporomandibular joint. That's just the anatomical name for our jaw joint. It's located just in front of the ear, and so each human has two TMJs on each side of their face. The TMJ is comprised of three main types of structures. First, you have the bones. You have the ball of the mandible that fits in the socket of the temporal bone. That's where you get the term temporomandibular, because it's the temporal bone and the mandible and the way they fit together. This is a ball and socket joint, just like shoulders and hips. It's the only joint in the body where, in normal function, the ball routinely comes out of the socket. Another important part of the joint in the anatomy is the cartilage disc. There's a small piece of cartilage that sits in between the ball and the socket, and this disc is the source of a lot of our TMJ problems, which we'll get into later. The last component of the joint that's very important is all the muscles surrounding the joint. There are many different muscles. We call them the muscles of mastication. They are the muscles used to cause the joint to function, to open and close your mouth, to chew, to eat, to speak, to yawn, to laugh. We use this joint all day, every day. TMD stands for temporomandibular disorder or dysfunction. This is the term that is properly used when someone has a problem with their TMJ. Many people will say, I have TMJ, but the actual term you should use is TMD. Temporomandibular disorder can be caused by many different things, and it can be characterized by different things. There are disorders with the bones. Those would be a type of arthritis or degenerative joint disease. There are problems with the disc, which can be a slipped disc, just like the discs in our back between our vertebrae can slip out of joint. The same thing can happen to the disc in your jaw joint. And then also you have disorders of the muscles. Typically these manifest in muscular type pain, which we'll get into when we discuss the symptoms of TMD. TMD is very common. It is experienced by many adults, especially in the United States. It is much more common in women than in men. And if you think about how important this joint is and how constantly we use it, it's not unusual for it to have disorders. What causes TMD? There are many different types of causes, and there are many different types of TMD. So I'm going to go over a list of possible causes. There are many times where it can be a combination of 2 or 3 different things that led to having a problem in the joint. One of the causes that we see commonly is genetics. There can be inherited joint disorders like rheumatoid arthritis. There can be inherited cartilage disorders that can cause the discs to not properly form. There is another cause that is injuries. This is the most common cause of problems within the joint itself. When we're children, we fall and we hit our chins a lot as we're learning to walk. People who are in car accidents often hit their chin on the steering wheel. Any injury to your chin or to the lower jaw is going to affect the joints by your ears. Those injuries cause damage to the joint, and over time, just like an old football injury can give you arthritis in your knee as you get older, the same thing can happen in the jaw joint. Another cause that's important is microtrauma. What microtrauma means is that it's very small injuries that are consistently applied to an area over a long period of time. So this would be something like clenching or grinding your teeth. There's an improper amount of force put on the joint when we clench or grind our teeth very hard at night, and so that happening over a long period of time causes microtrauma to the joint. Another cause of TMD is stress. Many people are aware of this. When we are stressed, sometimes our muscles can be tense and tight. A lot of clenching and grinding occurs because of stress. The last cause that I have to discuss is called an improper bite. We call that a malocclusion in dentistry. When the teeth do not fit together properly, that can cause someone to bite differently, where the jaw joints are not able to be in their proper position in the socket because of the way the teeth fit together. If the teeth fit together to one side, then that would push the jaw out of whack, causing a strain on one side of the joint. that can be addressed with dental work, and the diagnosis is the most important thing. In order to diagnose TMD, there are many steps that are necessary. It definitely involves imaging of the joint. A 3D image of the bones is wonderful. A 3D image of the soft tissues is even better. That's accomplished through an MRI. How do you know if you have TMD? Well, there are many symptoms that I mentioned we would discuss. The first and most common is muscle pain. This manifests in headaches, so many people get headaches in the region of their temples. There's a large fan-shaped muscle here in your temple that comes all the way down and helps to close the jaws. When you clench or grind your teeth, you're flexing this muscle harder than you're supposed to. It can also extend to pain in any of these facial muscles, pain in the muscles of the neck. Because all of the muscles of our head and neck work together to accomplish these movements, they can affect each other. Another symptom is muscle tension or tightness. Not everyone has pain, but they wake up feeling like their muscles are very tight and sore from clenching all night. You can have symptoms in the ear. Because of the proximity of the jaw joint to the ear, there are times when pressure in this joint creates ringing in the ears, dizziness, or even pain in the ears. You can experience joint sounds where you have a click or a pop when you open or close. This is caused by that disc being out of its proper position. You can also have gravelly or crunchy grinding sounds. That usually occurs when the disc is no longer in between the ball and the socket, and so you have bone grinding on bone, and that creates a crunchy or gravelly sound. That's not a good thing. Another symptom you may experience is limitation in your joint function. This could be that you're not able to open your mouth as wide as you normally could. It can mean complete locking where you can't open at all, or it can be an open lock where your mouth is open and you're no longer able to close it. The other limitation you can have is an inability to move your jaw from side to side in a chewing motion without pain. So for treatment options, there are a wide variety of treatment options, as you probably see from what we've discussed so far. This is a complicated issue. It's a complicated joint. It's complicated to diagnose. There are many different causes of it. There are many different classifications of it. So of course, treatment is not going to be a one-size-fits-all approach. There are conservative treatment options where you are basically treating the symptoms and trying to prevent further damage to the joint itself. The most common conservative treatment option for TMD is a night guard or a mouthpiece. This is an appliance made by your dental office, made by a dental lab usually, to wear at night to protect the teeth from grinding forces, to separate the teeth so that muscle force is reduced, to reduce strain and pressure and compression on the jaw joint itself, and to put the teeth in a better bite relationship so that the jaw joint can have a break at night while you're asleep. Another conservative treatment option is physical therapy. There are physical therapists who specialize in TMJ disorder. If you are interested in physical therapy to treat a TMJ problem, ask your dentist for a referral. They will work with you in their office and also give you exercises to do at home. Many people also seek out chiropractic care or massage therapists to alleviate some of the discomfort of TMJ disorder. There are also less conservative treatment options that involve surgery. Because there's a wide range of possible problems in the joint, there's also a wide range of surgical options, from things as small and simple as what's called a lavage, which is a liquid flushing out of the joint to remove inflammatory tissue and to help clean the joint out and kind of give your body a chance to start over, all the way up to a very, very invasive and complicated total joint replacement where these jaw joints no longer are your bones anymore. They are recreated out of titanium joints. There are some cases where the bones have degenerated. There's severe problems that cannot be repaired, and so the joint has to be replaced. As you can tell, this is a complicated issue. We would love to answer any questions that you may have about it. Please feel free to give us a call or set up a consultation with Dr. Agrawal to discuss your specific issues. Thank you so much for watching, and have a great day.